to Sri Ram Medical College. Today we will explore optometry and children, ensuring your little one's eyes are healthy and strong. A child's first eye exam should typically take place around the age of 6 months, as this is when a baby's eyes and vision have developed enough to be checked by an eye doctor. During the exam, the eye doctor will check for any potential issues with eye alignment, eye movement, and overall visual acuity. They will also check the health of the eyes and look for any signs of problems such as crossed eyes or a drooping eyelid. It is important to have regular eye exams for children to ensure their eyes are healthy and strong. These exams can detect vision problems such as nearsightedness, farsightedness, and astigmatism, as well as other issues such as amblyopia, lazy eye, and strabismus, crossed eyes. Children should have their first eye exam at 6 months of age, and then again at 3 years old, before starting school. After that, children should have eye exams every 2 years, or more frequently if recommended by an optometrist. In addition to regular eye exams, parents should also be aware of any signs of vision problems in their child, such as squinting, tilting their head, or rubbing their eyes. If you notice any of these signs, it is important to schedule an eye exam as soon as possible. Optometry and children go hand in hand, as it is important to ensure that a child's eyes are developing properly and that any vision problems are detected early on. Pediatric optometrists specialize in the care of children's eyes and are trained to detect and treat a wide range of vision problems that can affect kids. Visual acuity, eye alignment, and other eye abnormalities are checked during a pediatric eye exam. They may employ child-specific eye charts and tests. If a vision problem is detected, the optometrist will prescribe glasses or contact lenses, or recommend vision therapy to correct the issue. It is important to note that during the first exam, the child might not be able to cooperate fully with the test, therefore doctor will use different tools and techniques to evaluate the child's vision. It's generally recommended that children have regular eye exams every 1 to 2 years, or more frequently if there is a concern about their vision or if they have a history of eye problems in the family. It is also important for parents to be aware of the warning signs of vision problems in children, such as avoiding close work, squinting, rubbing eyes, and frequent headaches. If a parent notices any of these signs, they should schedule an eye exam as soon as possible. With proper care, children can develop and maintain healthy vision throughout their lives. A pupil response test measures your infant's light response by opening and closing their pupils. A fixate and follow test can show how well your infant can focus on a moving target. Typically, a baby's ability to focus on an object develops within the first month of life, and their ability to follow an object develops around the 3rd month. Your infant's visual acuity can be evaluated with a preferential gazing test, in which cards with one blank side and one striped side are used to capture the infant's attention. Optometrists ensure proper visual development during crucial early years. Optometrists detect and correct vision problems such as nearsightedness, farsightedness, and astigmatism. Optometrists detect and treat amblyopia, lazy eye, and strabismus, crossed eyes. Optometrists detect and treat eye diseases such as retinoblastoma, congenital cataracts, and congenital glaucoma. Optometrists align eyes. Optometrists improve school vision. Optometrists detect color vision problems. Optometrists diagnose depth perception abnormalities. Optometrists detect and address any issues with visual perception and visual motor coordination. Optometrists ensure that any eye problems are caught and treated early before they become more severe. Optometrists ensure that children are able to engage in daily activities such as sports and reading without any visual difficulty. Optometrists detect and address any issues with visual spatial skills. Optometrists detect and address any issues with visual memory. Optometrists detect and address any issues with visual attention. Optometrists detect and address any issues with visual perception skills. Optometrists ensure that children are able to see comfortably and clearly while using digital devices. Optometrists detect and address any issues with visual processing skills. Optometrists detect and address any issues with visual motor integration. Optometrists ensure that children's eyes are healthy and strong throughout their life. Optometrists detect and address any issues with visual perception skills related to learning difficulties. Vision screenings for children are important to identify potential vision problems early on. Rapid, non-invasive exams can detect nearsightedness, farsightedness, and amblyopia, lazy eye. Screening methods can evaluate eye alignment, motility, and visual acuity. Visual acuity testing measures the child's ability to see clearly at different distances. It is often done using a chart with letters or symbols of different sizes. Cover test checks for eye alignment and muscle balance by having the child cover one eye while looking at an object in the distance. Refraction test uses a machine to measure the child's need for glasses or contacts by shining light into the eye and measuring how it bends. Myopia, sometimes known as nearsightedness, is a common refractive defect that affects billions of children around the world. Myopia is the inability to see things in the distance clearly. Your eye doctor can then determine how well your child sees at both near and far distances by having your youngster identify these symbols. A random dot stereoscope tests your child's three-dimensional vision and eye coordination. This evaluation requires 3D glasses and a well-spaced dot chart. Most hyperopia is genetic, however pregnancy or childhood eye disease or damage may increase risk. 6 and 3-year-olds should be checked for vision. Then, 1-2-year screenings are indicated. However, this can vary depending on the child and their individual needs. An objective measurement of refractive error can be obtained by retinoscopy. A retinoscope will be used to shine light into the child's eye and examine the reflex. Pediatric optometrists diagnose and treat vision issues. They are equipped with the knowledge, skills, and tools to perform eye exams and diagnose vision problems specifically in children. They are also trained in the use of specialized testing methods, equipment, and techniques that are tailored for children's eyes. Optometrists have specialized training in pediatric optometry and are able to detect vision problems that may not be apparent to a general practitioner. Optometrists can use children's eye-specific equipment and methods. Optometrists can treat children with glasses, contacts, and vision therapy. Optometrist is able to work with children in a way that is comfortable for them and can make the eye exam experience less stressful for the child. Optometrist can also work with parents and teachers to ensure that a child's vision problem does not negatively impact their academic and social development. Optometrists identify, diagnose, and treat children's vision problems and have the knowledge, skills, and equipment to keep kids' eyes healthy and strong. Optometrists ensure that children are able to see comfortably and clearly while playing video games. Optometrists ensure that children are able to see comfortably and clearly while watching TV. Optometrists detect and address any issues with visual perception skills related to dyslexia. Optometrists ensure that children are able to see comfortably and clearly while reading. Optometrists identify dyscalculia and dysgraphia-related visual perception difficulties. Optometrists help kids play sports comfortably and clearly. Optometrists ensure that children are able to see comfortably and clearly while using a computer. Optometrists detect and address any issues with visual attention related to ADHD. Optometrists detect and address any issues with visual perception skills related to dyslexia. Optometrists detect and address any issues with visual perception skills related to autism. Join Shri Ram Medical College's Bachelor of Vocation and Master of Vocations in Optometry and Ophthalmic Technology and take the first step toward a successful career in hospitals. We are here to assist you in launching your medical career. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.